Hi, I'm Dr. Keith Loud, pediatrician and physician-in-chief at Dartmouth Health Children's. Many of you may be hearing or seeing a lot in the news or your social media feeds about an RSV surge that is harming children across the country and in our region. I'm here to help reassure you that here at Dartmouth Health Children's, we are taking all the appropriate steps to help you and your children get through this and answer some questions along the way. Respiratory syncytial virus, or RSV, is one of a variety of respiratory viruses that cause upper respiratory and lower respiratory infections, which we know as common colds. Sometimes people call it bronchitis or pneumonia. But RSV has a particular tendency to affect infants and our youngest toddlers. And because their airways are so small at that age, they fill up with mucus, which plugs those airways and makes it very difficult to breathe and get oxygen into their tissues. That's the fundamental challenge and why we see so many young children affected by RSV year in and year out. There are other viruses that can cause similar pictures. And in fact, earlier this fall, we saw other viruses like rhinovirus and enterovirus cause the same problem. And we know that influenza, the flu, is on the way and can cause difficulty for children as well. This is no typical winter. And we're seeing record numbers of children, unfortunately, needing to be in emergency departments and in hospitals across the country to get extra support in inpatient units. This includes oxygen support and other nursing care because there's no known vaccine for RSV and there's no medications available that helps it heal quicker. The biggest message I can share is never worry alone. Pediatricians at Dartmouth Health Children's and family medicine practitioners at Dartmouth Health are expert and available to answer your questions when you have concerns. We are making sure that we have availability for our patients. As the largest pediatric health network in the state of New Hampshire, we have offices across the region in New Hampshire and Vermont. And we're making sure that there is office space and time to be seeing kids with RSV and other respiratory illnesses. Dartmouth Health Children's is also helping our region address this unprecedented surge. Our experts in pediatric hospital medicine, pediatric critical care medicine, pediatric infectious diseases, and general pediatrics are collaborating with hospitals across the state to ensure that there is appropriate equipment should children need to be seen in emergency rooms in hospitals in your community, as well as capabilities to sometimes admit those children to hospitals where they might not typically be seen. Using telehealth and other communication, we can bring expertise to the bedside at local hospitals. Our transport teams are also running to make sure that the most critically ill children can have access to our critical care capability at CHAD and that those services are as available as possible. To that end, we've actually expanded some of our space in our inpatient unit at CHAD, taking over what is known as the pain-free space that some of you may have accessed. And those are inpatient beds and staffed nursing beds to allow us to, again, meet this overwhelming and unprecedented surge. So once again, we're all in it together. Just as we did through the COVID pandemic, we can pull together and help kids through this circumstance. For children, any respiratory virus can actually land them in the hospital. So stay home if you're sick. Probably try and stay away from young children if you know that you're sick, even if you're not feeling that unwell. Washing hands, as we've learned from the beginning of the pandemic, is always a good idea. And we can do our part by getting vaccinated against COVID and influenza, because those under age 6 months of age cannot be vaccinated against those particular viruses, and that will help decrease the surge and the risk from those illnesses. It's not just about RSV. We will be always available with more information, not only in your primary care office, but at chadkids.org, where the latest updates will be posted.